Hello, everyone, and welcome to our faculty discussion on the future of diabetes care. In this video, our expert faculty will discuss how transformative postgraduate education can shape expertise and confidence in managing diabetes, one of the most complex and evolving areas of modern healthcare. At Learner Diploma FC, we understand that clinicians like you are at the forefront of improving outcomes for people living with diabetes. And that's why our postgraduate diploma and MSc in diabetes have been carefully designed to combine clinical evidence, emerging technology, and interdisciplinary collaboration, all delivered through flexible, fully online learning. And in today's video, we'll talk you through our diabetes programs to show you how they work in practice. And then you will learn about the structure and core learning outcomes, how our curriculum connects with related specialities and real-world clinical decision making, our interactive learning methods that mirror real practice, and how our assessment approach supports your professional development. Now, I'm delighted to introduce you to Dr. Vinay Elgar, Program Leader for Diabetes. Dr. Vinay will start by sharing a bit about his background and giving us an overview of the course, who it's designed for, and how it helps healthcare professionals advance in their expertise in diabetes care.
Hello, everyone. My name is Dr. Vinay. I'm one of the endocrinologists currently based in Abu Dhabi, Imperial College London Diabetes Center. But my training has been in Wales through and throughout, and I worked as a consultant in diabetes endocrinology at University Hospital of Wales, Cardiff, for a long time before moving to the sunnier parts of the world. So the diabetes program is designed in a way to reflect what is the challenges and how we can personalize the treatments, personalize the diagnosis, individualize it to the person. So our course encompasses a holistic view towards diabetes because it's one of the increasingly common chronic conditions that we come across now. Every healthcare professional, their path is going to cross through diabetes. 20% of our inpatients are having diabetes. So it's not just for physicians or persons who are interested in diabetes, but it's also for most of the other specialties, allied healthcare professionals as well. So we have designed two modules, which I'll be talking about. Instead of modules, I should say two courses. One is diploma in diabetes, and another one is MSc in diabetes. So if somebody is trying to get the first steps into the diabetes world and want an upgrade in their skills, I would suggest they should have a diploma in diabetes, which runs over a period of 1 year and is divided into different modules from module 1 to module 6. So we have been curating our modules very closely in association with the American Diabetes Association guidelines and EASD, that is European Association for Study of Diabetes. So our prime goal is to keep up with the developments that are happening on a yearly basis because diabetes world is rapidly changing. What we are diagnosing and treating now in 2024, we were thinking about it differently in 2015. So what you will do in next 5 years is going to be completely different. So this is a rapidly progressive and changing world where the paths of diabetes, the obesity management, increasing obesity, all of these are crossing paths. So it is one specialty of medicine, actually one diagnosis which has become a specialty on its own. So you can imagine how vast it can be. But to simplify it, we have designed a course and the learning path is going to be slow and steady, but gets steeper as your baseline knowledge improves. So we have taken into consideration all these things and designed the module 1, which puts you into the basics of diabetes, basics of glucose metabolism, how to diagnose, how to personalize the diagnosis, how we can think differently outside the box, and to think as if you're a specialist. So those things will be put across, grilled into in the first module. And your journey goes through module 2, 3, 4, and 5, 6. And as we progress, we are going from diagnosis to how we actually bring in the soft skills required and then move on to the management aspects, which we have expanded now, knowing that there is so much new happening. We are bringing how to use technology in management of diabetes effectively and bringing that on board into our course material as well. And then we move on to the complications, how prevent the complications. We've given very important time to analyze some of the pivotal studies that have changed the landscape of diabetes management. And we emphasize upon that more often because these have become the pillars of managing diabetes effectively. And we moved away from just the glucose control to actually getting to the complication management and moving and thinking forwards how you can prevent it in your population. So we hope that by doing a diploma MSc, you'll have a very, very holistic view on clinical aspects of diabetes.
Excellent, very informative. Thank you so much, Dr. Vinay Alagar. Now, we also have with us our Medical Education Director, Dr. Anish Kotecha. Anish, if you could provide an overview of our diverse range of diabetes courses and the interdisciplinary connections, that would be brilliant.
Thanks, Jess. That's really helpful. Hi, everyone. My name's Anish Kotecha. I'm a GP by background, but also in the 9 years I've been a GP, I've developed a portfolio, I'd say, organically in medical education. That's kind of been my passion project, and I'm really fortunate to be associated with Learner. Really excited to have you on this webinar, and thanks very much for joining us. So, as Jess said, I kind of just wanted to outline some of the other programs that we have available to you. Often as a healthcare professional, I found that I do one course and it kind of develops a real keen interest of mine where I want to do related courses. And I thought it'd be helpful just to outline some of the kind of related courses that you may well be interested in. So we do have a wide portfolio of programs. And okay, if we're talking about diabetes, we also have a postgraduate certificate on metabolic medicine, and that's been quite well received. We all know how common metabolic syndrome is and how many patients we treat in our clinics. And I think that course is really well geared to teaching us all about metabolic syndrome, about diabetes, hypertension, high cholesterol, and obesity, which is so prevalent now. And so that's a really short and sharp program for you to kind of get within 6 months. So really quick, really focused learning, and the people currently on that program are really getting a lot out of that and interacting with our tutors. So we've got a postgraduate certificate in metabolic medicine, which is doing really well. We've also got one on thyroid medicine. And now, of course, in primary care, I'm a primary care physician, and we often treat people with hypothyroidism, but really interesting to know about hyperthyroidism as well. So got a postgraduate certificate on thyroid medicine that might well appeal to some of you. We've also got a course on endocrinology, and this is really geared towards the primary care and secondary care interface and really working as best as we can with our allied healthcare professions in a very interdisciplinary way. So we have got programs in endocrinology where you may want to have a look and see what our curriculum really looks like and the content looks like for our course on endocrinology. And actually, really interestingly, we've got one coming up now in hypertension. So we've created a 6-month program which really gives sort of key information to you on how to treat hypertension, how to look for hypertension, really digging into the guidelines on hypertension in the most common population, but also thinking about some of those secondary causes of hypertension and really what you should be looking for. And again, how you can utilize some of the other people that will be in your practices, some people like pharmacists or physicians associates, that you can really utilize their skills in how to look after or manage your patients with hypertension and really get protocols into the practice that allows them to become involved, that may free you to look at other people with other conditions. So really utilizing that multidisciplinary team. The courses are all designed to have multidisciplinary members on there, and actually I think that's really key, and I think Vinay will touch up on that in some of what he says. But really what we find on our programs is having various people from various disciplines, nurses, pharmacists, physicians, associates, really interacting with our tutors really helps each of us learn what all of these allied healthcare professionals do. And that's a really interesting interactive conversation that comes to light on our programs. So hopefully that's given you a little bit of a taster of some of the related courses that we have, some of the versatility that comes with standalone qualifications, and giving you post-nominals, which you can get out of 6 months of learning for our PG certificates in particular, but also the utilization of a multidisciplinary team. And hopefully that's been quite useful for you. And if you do have any questions, always remember you can come back to us if you need to.
Brilliant. Thank you so much for that detailed overview. Okay, so now we come to the interactive learning session portion of the webinar. Dr. Vinay Elgar will be providing us with a mini taster of how active learning is done at Learner through case scenarios. Dr. Vinay Elgar, can you explain the importance behind creating this teaching demo for students, and if this is something students can expect to see more of during their time on the programme?
Thank you, Jess. So I wanted to highlight, just to bring a flavor to what kind of case scenarios we use. I should say we collect a lot of study material, and the contributors are all our tutors, our own clinical experience, and we bring real life case scenarios into the teaching, and actually what you see or what you learn during these case scenarios is actually what you'll practice as well, because you'll invariably come across similar scenarios in your clinical life. And that's what we aim to do, actually, is to bring some kind of evidence-based practice from the study to your clinical practice. And I will share with you one case today. Okay. So what I have here is one case to show to you, and we'll see how the case unfolds itself. Okay. So what we have is a 19-year-old student who attends her general practitioner for recurrent UTIs and thrush, the urogenital candidal infection, which is thrush. And if you are a general practitioner, or if you are one of those kinds of a physician who is seeing a person like this, you would obviously do capillary blood glucose, and it was 11.4 millimoles for this young girl. On examination, she has a normal BMI. There are no osmotic symptoms. That means she's not having any kind of excessive thirst or excessive use of going to the toilet for passing water, but she's concerned about these recurrent infections. Importantly, her mom has type 2 diabetes and she's managed on metformin, and her grandmother is diagnosed with type 1 diabetes and has an excellent control on twice a day insulin. And she also has an 11-year-old younger sister who is doing very well at the moment. So this is your clinical scenario where a 19-year-old comes in with concerns because of UTI, and you pick up that she has high blood glucose, which is, if you look at the random level of the glucose level here, it's quite high, 11.4 with infections. So if we go through the story and think of whether this is diabetes, obviously she's symptomatic and the glucose, random glucose is much higher. So we can say, yes, she's got some kind of diabetes. And the natural process is to do a HbA1c. So the HbA1c is 44 millimoles per mole. And a urine dip was done, which showed no ketones, but positive for glucose. So more blood tests were requested. Anti-GAD antibodies were done, which was minimally elevated. Anti-islet cell antibodies were negative. Zinc transport 8 antibodies were negative. So this is, I've obviously taken a case scenario which is slightly not straightforward. But by the time you come across cases like this, you would have had ample time to learn different types of diabetes. What are the different criteria to diagnose different types of diabetes? And so that you individualize the plan of management, and the diagnosis is precise. We call it as precision diagnosis in diabetes nowadays. which is very, very well known because previously we used to think type 2 diabetes is just type 2, but now there's a heterogeneity in type 2 diabetes. We can divide them into 5 different classes actually, which you will understand when you're going through the module materials. So here it was a bit perplexing that she has got high blood glucose in the capillary blood, but the HbA1c is very minimally elevated in a pre-diabetes range. She's got positive glucose in the urine, but her antibody profile is largely negative with the very minimal elevated GAD levels, which could be negligible, and we should not be swayed away because of very mildly positive GAD, because 2 to 3% of population can have a mildly elevated GAD levels. So she had a oral glucose tolerance test. As you can see, the fasting sample showed a blood glucose of 4.3 millimoles. At 120 minutes, the blood glucose was much, much higher, 14.7 millimoles. Clearly, she has diabetes. The fasting is negative or it's normal. So this kind of a scenario is something that we will only think about if we know all the different types of diabetes. So what should we do next? What is the most likely diagnosis? So to make your life easier, I would not ask you to read through it now, but if you just look at all the different types of diabetes, we have type 1, type 2, and the last three are all what we call as maturity onset diabetes in young type of diabetes. And particularly with the HNF1 alpha and 4 alpha mutations, what you would find is elevated postprandial glucose, but normal fasting. And among these two, one of them has positive glucose in the urine, that is 1 alpha, and 4 alpha will be not having any glucose in the urine. So there's no glucosuria with 4 alpha, but 1 alpha, of course. And the reason why we think about Modi here is she's a young person in her second decade and has a good family history of diabetes. We don't know exactly whether mom also has a similar type of diabetes. And maybe grandmother also has similar type of diabetes because she's only managed on 10 units of insulin per day, total daily dose of insulin, TDDI means total daily dose of insulin. That all these information make me suspect that this probably her grandmother is not type 1, her mom is probably not type 2, and we went ahead, and if we do particular tests for genetic analysis for Modi, we will be able to figure out whether this is 1 alpha or 4 alpha. But with the scenario, what we think it is 1 alpha based upon all these different information I gave you. So obviously, I've made this scenario quite complex, but I wanted to give you a flavor how complex diabetes can be, and we can make it simpler if we go with the learning in a stepwise way. So this is just to give you a flavor of how we teach and how we present our information to you. So obviously this patient had glucosuria, postprandial hyperglycemia, and she would probably be HNF1 alpha if we check her genetic analysis. And indeed, we've done it for her and it was Modi. So this is the clinical scenario kind of a case I wanted to discuss with you. And most of the cases will be starting with simple patterns, simple ones, which we see mostly. And as we gain more and more knowledge, we go on to complex ones, which you will see less frequently, but it is very important to recognize those less frequently occurring ones as well, because that is when you're going to give personalized care to your patients. I'll stop this slide sharing and hope that was a useful case scenario for you to understand the detailed way of analysis, which we will be able to teach you over the period of our course.
Thank you, Dr. Vinay Eliger. That was really insightful. A lot of information to take away there. Before we dive deeper into the assessment methods, let me just briefly outline our approach to student evaluation. At Diploma MSc, we believe in applying real-world assessment and that enhances your clinical practice. Our assessment methods are designed to integrate seamlessly with your learning journey and reflect real-world clinical scenarios to develop critical thinking and decision-making skills. And with that, I'll now hand over to Anish and Vinay, who will provide more detailed insights into our assessment structure. Dr. Vinay Elgar, if you would like to go first.
So the assessments is done through various methods. We usually use clinically rich scenarios, which bring in a flavor of what is happening in the clinic onto your screen. And then we mix it up with the experience from our tutors and the feedbacks, and also how you respond. And then every STEM is actually tutored by one of our very good moderators, and they will hone your skills towards the right path. That's the key. So every week, you're going to have multiple clinical scenarios, which are all clinically rich to reflect what happens in real world, not only just in, say, Western world. It could be somewhere you may be practicing in an area which is actually having limited resources. How do we manage in those scenarios? So we bring all these things to upskill your knowledge base. And the assessments are done on a weekly basis. You will be quizzed by our moderators in a very friendly way. They're very good to bring the best out of you. We always have a constructive criticism as a backbone of our teaching, and we believe in giving you all the resources and the tools in your hand to make that kind of a learning process much smoother. And our feedbacks have been excellent up until now, the way the teaching is going on. So we are quite proud of those feedbacks. So the assessments involves on a weekly basis, plus within the module, you have a group. You are working with a group of other students. So you actually exchange a lot of knowledge through your group as well. And there is sometimes group activity or individual activity, which forms a part of the assessment. And of course, reflection on what you've learned every week makes a personalized kind of information to yourself, how you're learning. It's like an honest feedback to yourself. How am I learning? Where are my pitfalls and how can I improve them? And we as course director or moderators and the tutors are always there to help you through this course. And we, of course, have MCQ-based exams at the end as a part of the assessment. But all the MCQ-based questions are something that will be clinically relevant again, which you have learned during your module. So that's how the whole the diploma is based, and we put it across. Of course, I'll be able to expand a little bit more on the different modules at a later point. But I would like to hand over to my colleague Anish, who is the head of learning, who may be able to add more than what I have suggested.
Yeah, thanks, Vinny. Yeah, there's very little to add to that, but I think from learner's perspective, what I would sort of say, and just to summarize it, because that was really well put, is kind of then if you think about it, we've got 4 assessment methods. We've got the academic forum. Usually, guys, that makes up kind of 40% of your marks, and that is, as Vinay has suggested, it's a kind of an online forum for all of you to come and discuss a very clinically rich case. But not only what we're veering away from is just information recall. As Vinay said, this is about clinical application. There's no point just learning information for the sake of learning information. This is a program designed, our mission statement at Learner is really to improve global healthcare through medical education. So it's really getting you to understand the information, but then being able to clinically apply it. And actually, that's where the MDT comes in, because actually you might get a nurse from somewhere in Africa that has limited resources, exactly as Vinay said. And how would you work something? How would a protocol or guideline really allow you to give equity of care in your area? So it's about kind of honing that conversation and actually discussing it between yourselves on the forum. So it's about, someone in the UK might have an MDT approach and they might have a consultant they can get hold of quite easily, or a nurse that would see patients that may not apply everywhere. So it's about having those really rich, clinically rich scenarios, but actually having those enriching conversations that really do pull on what resources you have available to you and actually sharing your own experiences to how you manage your own patients. So Well, that's the academic forum. That's kind of an online forum where you can discuss these cases. That's 40% of your marks. So 10% is then the reflective journal, whereas Vinay has suggested the most important thing in medicine, and as a GP, I'm doing this all the time, is reflecting upon what you're learning, how you're putting it into clinical practice, and then coming back in subsequent weeks and actually suggesting, right, so I've learned this, I've changed this in my practice, but actually I now have learned I need to go and learn about this. And so it's that reflection, and that's worth 10% of your marks. You can pick up some marks just by, I say just by, but by reflecting. 30% comes from the end of module MCQ exam, and all of those questions are going to be related to the clinical topics that you're covering within the academic forum. So if you go along each week, as Vinay suggested, and contribute and engage, through which, by the way, you're picking up your marks, you will learn about the things that will be covered in your exam at the end of that 6 weeks of that module. So that's kind of where 30% of your marks come from. And then the last 20%, and Vinay's alluded to this as well, is the module activity, which can be an individual or a group activity. Now, this is really where we, and Vinay would be responsible for the diabetes program, really to develop your postgraduate skills, the kind of skills that you'd really want to develop your career prospects. So, designing a poster for a conference, kind of one of the first things I think I did when I became a GP is I went to a conference and I designed a poster where it got recognized, or maybe writing a blog for a public or a public facing audience or healthcare professionals, or maybe doing a narrated presentation on something, or writing an abstract, or really interestingly now, critiquing an AI generated abstract, and seeing where flaws in AI start developing, how it hallucinates. So these are really key aspects to help you hopefully develop your career prospects in other ways, or becoming a key opinion leader. We have got some module activities where it will ask you if you're comfortable to develop a persona or a reputation on social media by kind of making an account and posting something that's relevant. Or sometimes writing a blog where we can host it on our website. So really things that are key to developing your career prospects. And I think that's a really exciting element of our assessment.
That's fantastic. Thank you both for your insights on student assessments. Before we close, I'd like to extend a sincere thank you to everyone for watching. We hope we've shown you how our programs can empower you to make an even greater impact in diabetes care and related fields. And if you'd like to learn more about our diabetes program, please visit our website at learner.ac.uk, where you'll find full details on course content, the structure, and how to apply. And of course, our friendly admissions team is always available at admissions@learner.ac.uk if you have any questions and would like any personal guidance. Thank you once again for watching. We hope to welcome you to our learning community soon. Take care and goodbye.